So what to expect with your gingival graft? So we're gonna get you in, we'll go through some paperwork for you, we'll go ahead and we'll get you numb wherever we're doing those gum grafts, we'll go ahead and we'll get you numb there, and also wherever we wanna take that gum from. A lot of times we'll end up taking it from kind of the backs of the molars up on the top there, sometimes the palatal area, and that way we can numb those up as well. So you won't feel any pain, anything like that when you're undergoing the procedure. So during the procedure, you just basically have to keep your mouth open for the procedure, and depending on how many teeth it is, it's anywhere from 30 minutes to even a couple hours if we end up doing a lot of teeth there. So that's what to expect with that. And as far as discomfort after the fact, you're going to be sore in whichever areas we worked on. You're going to be sore there and also up in the palatal area. The palatal area won't be as bad as what you read online a lot of times because we take it very, very thin. We take a thin piece of gum, and a lot of people take a really thick piece of gum. So that's something that we do to actually minimize any kind of discomfort. We do it much differently than most people out there. So as far as the discomfort, usually you'll be sore for about a week. The first 3 days are when it's gonna be, the most sore. It'll throb a little bit here to there. And after that, the pain is gonna basically just disappear over the course of the next, few days or so. So figure about the first 3 days being pretty sore, and then after that it tapers off, and then you're good after that, after about a week. So that's what to expect with that gingival graft procedure.